Nick Ferrari at breakfast. Call 0345 6060 973.
9 minutes before 8 is the time, just before we speak to Mr. Hancock. Some of the emails, texts and tweets that are coming in on the row over holidays. This is an interesting one from Nicola in Italy. I live in Italy. The UK has brought so much vaccine it could inoculate its population around 5 times over, leaving other countries having far less. And the last thing we want is a lot of drunken Brexit, non-mask wearing, no social distancing, marauding Brits descending on Italy and infecting us. Stay at home, please. Luckily, we have a huge domestic market. Hopefully, the Italian government will soon shut our borders. That's Nikki in Italy. Thank you for that. Strong views. Same subject. David Richardson in Potter's Bar. We have to make sure not only the UK has been vaccinated, but all destinations are also at the same level. Countries such as South America and Africa won't be in a position. Well, that, I would suggest, sir, means no one will leave the country probably for the next 2 to 3 years. Rich Glover, people need to get over it, for heaven's sake. I've changed your words. Much more important things than going on holiday at the moment. Let's just pause for it. It's not all going on holiday. A lot of it is, of course, but a lot of it is business travel. It's visiting family members you have not seen for over a year. It's visiting possibly family members who've lost other members of your family to offer comfort and support. That's what it should be as well. And it probably needs to be stressed. Zin in Putney, what are your holiday plans? Good morning.
Good morning, Nick. Well, I was going to go to Iceland, but then I decided Waitrose was closer, so no, but seriously.
Now, that's a good line. I like that. Yeah, go on.
You can feel free to use it.
I will. Steal it.
We were off to Florida. We have a home there, and we were off on the 21st of March. British Airways canceled our flight, which is great because we got our money back.
Okay.
We've got another one booked for October. If we go, we go. If we don't, we don't. I don't see it's not a birthright to get to go on vacation. You live in a gorgeous country. Stay the heck home. Be nice.
Yeah, but think of folk who've got loved ones overseas who maybe have lost a mum or a dad.
I've got loved ones overseas. I'm sorry. I hope they live to see me next year.
And I hope you've not lost anyone. But if just say you'd lost your mum and you want to see your dad, and this is the case, this is very, very tough for them, isn't it?
Well, yes, but I thought you were talking about holidays.
Well, no, it's all travel. I mean, this is the key, isn't it? It's not. Although we talk about it as vacation and it's called vaccine passports for vacations, there are reasons that families get together aside from just going away on holidays. Zin, I have to park it there. I loved your line about Iceland and Waitrose. Thank you, because I have the benefit on the Health Secretary on the line to give us more clarification. So Health Secretary Matt Hancock joins us now on LBC to talk about a reform, a bonfire of red tape. Yes, we've heard that expression many times before. But Mr. Hancock, in the teeth of a pandemic, hopefully not the middle, why is it the right time to reform the NHS? Good morning.
Good morning. Well, now is exactly the right time to help people in the NHS and in social care to deliver services, to support us, to look after patients with less bureaucracy. We have successfully removed some of the bureaucracy during the pandemic, and we've seen people working incredibly well, incredibly hard, flexibly on the ground to deliver care in very, very tough circumstances. But there are some of the rules that are set in legislation that need to change, and I'm really glad that the reception to these proposals has been so positive. We've worked with the NHS for a long time now to develop these proposals. It's all about helping people on the front line to be able to deliver more integrated care.
Those people on the front line, do you think possibly that they would benefit more from getting that pay rise that was promised, which I understand you told the Nursing Times in December is delayed until at least May? Wouldn't the nurses and others on the front line prefer the money rather than burning red tape?
Well, of course, there's a...
well, why delay it then?
There isn't a delay at all. We've had a pay rise for nurses last April, and we are on track to do this work. Actually, we listened to the independent advice of the pay review body. That's how these decisions are...
Did you appear in the Nursing Times in December saying that nurses will have to wait until at least May next year, i.e. this year, for the pay rise that had been promised? That's not true. The Nursing Times have got that wrong, have they?
Well, I haven't seen that article, but what I do know is that I know exactly where we're up to in the process, if you see what I mean.
Mm-hmm.
And
so when will the nurses get their pay rise?
The independent pay review body comes forward with proposals. As you know, pay for everybody else in the public sector has been frozen this year coming. but not for nurses, and the independent pay review body is doing the work.
So when will the money come forward? This is what I keep asking.
Well, I've got to wait for the independent pay review body.
But what's more important, Mr. Hancock, reforming the NHS or giving the nurses their money?
Well, frankly, making sure that we can deliver high-quality, integrated care with less bureaucracy will help to deliver better healthcare for everybody listening to this programme.
So that's more important than paying the nurses,
and
just
more
to clarify.
Of a join-up. And no, you don't just do one thing in government. As
Great.
Well know.
Great. I'm delighted. So when will the nurses get their money?
The wonderful thing is that often you do more than one thing at once.
Great. So when will the nurses get their money?
Yeah, working on NHS pay and listening properly to the independent pay review body, we can do at the same time as removing some of the bureaucracy and the rules that have made it harder to deliver care on the front line, and that's what I intend to do.
Can you clarify one thing? I don't know if you've seen the front page of the Metro today. Hol's on hold. You are going on holiday. Grant Shapps says we shouldn't be going on holiday. The Prime Minister says the same. Who's right, Secretary of State?
Well, we've all been saying exactly the same thing, which is that there is uncertainty. I know that people want certainty, but there is uncertainty because of the pandemic. And we're working very hard, and we want
Mr. Hancock, 10 days ago, Mr. Hancock, you said you had the hope for a happy and free Great British summer. That's very different from the Prime Minister saying, don't start thinking of holidays.
Well, that isn't actually what the Prime Minister said, as I'm sure you know. What we all know is that in a time of pandemic, there is uncertainty. And we've all lived with that for the last year. And people get that. Now, I absolutely hope for a Great British summer. And I'm working incredibly hard to try to make sure that that can happen. And the best part of that is that the vaccine rollout, which is our route out of this, vaccine rollout is going very well. With over 13 million people now been vaccinated. And that's our way out of it. And that's the way to a more, a safe and more secure future when you won't have to ask the Health Secretary whether you can go on holiday.
Indeed. I can look for. You're still going on holiday to Cornwall then, are you, Mr. Hancock?
Well, I booked a place months ago, and of course I hope to, but there is this uncertainty that we all talk about. So, that's why we've all been saying the same thing, but I understand how uncertainty, is a challenge.
Okay. Some onerous restrictions come into people travelling into the United Kingdom as of Monday, which could lead to a 10-year jail term if you wrongly try and deceive the authorities. Why did you not consult with your colleague Justice Secretary Robert Buckland over this?
Well, I have been talking to the Lord Chancellor, the Justice Secretary, and taking advice from his department, of course. And this is an important measure, this set of measures, to make sure that we have secure borders, so that people can't bring in a new variant that might stop the vaccine. It might not be as, the vaccine might not be as effective against.
Yeah, but you're in a situation now, Mr. Hancock, where you've Mr. Hancock, you've introduced a law by which a perfectly healthy individual could be incarcerated for 10 years for wrongly misleading about the fact he or she had been to Portugal. Perfectly healthy individual locked up for 10 years. What is your legal background on that?
Well,
I understood you were an economist. I didn't know you had a background in law.
And I take advice from the Ministry of Justice and my own.
So Mr. Buckland does support this, does he?
Yes, I've been talking to him about it. And
yet others in his post, you'll have seen, I'm sure. Kenneth Clarke, a colleague of yours, says we need to keep a sense of proportion. David Liddington questions whether it's proportionate. David Gauke sees it as disproportionate. Jack Straw says it is disproportionate. Those four Justice Secretaries, you know more than all of those, and I haven't even brought in High Court judges. That's a unique position in which you find yourself, Mr. Hancock.
The position I find myself is that I think it is incredibly important that we protect our borders in order to keep people safe. And given all the progress that we're making, we've got to protect that progress. And that's the approach that I'm taking. I make no apologies for it. I think it is very important.
I'm not asking you to apologise. I'm just asking you to justify why it's the same stretch as if I was carrying a firearm, and it's longer if I attempted to have sex with a 13-year-old girl for coming in from Portugal. What makes you think that's the right stretch?
Well, I think it is right that people should declare whether or not.
Of course.
If I can, Nick, if I could just finish my answer, it'd be great. It's right that people declare, because the opening question you said on this, how could a perfectly healthy person be subject to this? The truth is, with this disease, one of the problems with the disease is a third of people have no symptoms at all but can still pass it on. That is absolutely at the core of why it's so hard to deal with. And that's why we have to bring in these measures at the border. And we have to know which countries people have been to, because there are some countries where the new variants that we do not have the certainty of the vaccine working fully against them, where that is at large. And we've got to protect this country from that in order to protect the progress that we've been making on the vaccination program. So that's the approach that I'm taking. And I think that given everything we've seen over the last year, it's perfectly reasonable to take a tough approach.
Well, you mentioned the past year. You say it's incredibly important. You say you will stop at nothing. What stopped you for the last 12 months, or certainly the last 6 months, or even the last 40 days? What stopped you then?
Well, over the last 2 months or so, since these new variants have started to appear, we have taken tougher measures at the borders. We ended the travel corridor list, which means that everybody who comes in from abroad has to quarantine, whether at home or from Monday in a hotel from the particularly at-risk countries. So we have taken those measures, absolutely, as you say, to strengthen the measures at the borders since we've seen the new variants.
But not this measure. Now that is necessary.
That's right. And so we've been strengthening the measures, putting in place the hotel quarantine, which comes in from Monday. As we've seen more evidence, as we've seen the new variants arise, but before we've seen whether the vaccine works fully against them, because of course, if the vaccine does work effectively against these new variants, then life will become easier. But we haven't seen the results of that, and there has been some uncertainty. Therefore, I want to protect the progress that we've made domestically, and take steps to do that, even if sometimes they're tough.
You're on a tight schedule. Just two further questions, briefly, and it's important, I think, we get this across. The Prime Minister's addressed, it is estimated around 2 million over 70s who've yet to have their inoculation. I'm urging them to do it, because we're not going to get locked down until these folk get their inoculation. Just a word from you, Secretary of State, Secretary of State, if you would, to convince these over 70s they need to get their jabs. Mr. Hancock.
Well, that's right. We are on track to offer everybody over 70 a jab by Monday. We want everybody to come forward and take up that offer. Now, the take-up has been very high amongst, for instance, the 75 to 79-year-olds. 96% have already come forward. That is great. But every extra jab saves a life. And we know that a jab not only protects you, but also protects those around you. So to anybody over 70, we are there with the offer. We want you to come forward. We know the jab is safe. We know that it's effective. It's the right thing to do. Okay.
Finally, we've talked about some legal matters. I wonder if I can get a word from you. There are concerns over whether the Dame Cressida Dick, the Metropolitan Police Commissioner, was in any way involved in the so-called Nick the Fantasist case. Does she continue to enjoy the full confidence of the Prime Minister?
Well, I'm sure that she does. I haven't been following this case closely. It's obviously I've got a huge amount to deal with the pandemic, but I'm sure it's something that the Home Secretary is working on. But I think that Dame Cressida Dick is doing a very good job as the Met Commissioner. I work with her closely, for instance, on making sure that we can enforce the measures that we have to take to keep people safe from coronavirus.
Grateful for your time. Matt Hancock appearing here on LBC. Thank you, Health Secretary, where the 8 o'clock news is next.
On your radio, on Global Player, and
Play LBC.
Leading Britain's conversation. This is LBC.
From Global's newsroom at 8 o'clock, one of the government's top scientific advisors thinks the UK should be more or less free of the COVID-19 crisis by the end of this year. But Professor John Edmonds has warned against relaxing lockdown restrictions too quickly. He also says we should be very cautious about foreign travel and that some measures may be needed forever. Professor Lawrence Young, a virologist, is also optimistic.
I'm hoping that come the end of the year, we're going to be